Thank
There we
you.
go.
Thank you, Elizabeth.
So once again, today we're talking about how to make sense of changing health trends, and will be a practical guide to trend analysis. So the guiding question is it getting better? How can we see if things are getting better, if any disparities for marginalized groups are getting better, if things are improving, or if are disparities widening or narrowing when we compare them to their peers? That was the guiding question that got us started in the trend analysis. So we need a method that's able to test these trends and these disparities, these differences over time. So let's look at the basic concept, the skeleton of how we do analysis. We have cross-sectional data, so data that's from 1 year, specifically one chunk of a moment that lets us compare groups within a specific point of time. So let's say we're looking at differences between boys and girls. And we've got repeated surveys over many years that lets us do analysis that look at things over time. Many years of data that we have over these surveys. So if we put those together, we can look at how things change over time for multiple groups. So how are we looking at these groups? Why can't we just do percentages? We can compare the percentage of people that are looking at how things look differently over time. So when we do percentages, we are testing if there's differences, but for trends, we're going to be doing regressions. Regressions lets us look at likelihood, how likely are things to happen, an outcome to happen for the groups that we're looking at, and what are the things that are leading to that outcome. And a regression lets us account for the effects of other factors like age. So, for example, we've got youth that are LGBT plus. They tend to be older than the rest of the students because youth come out at later point in their lives. They don't go their whole lives just out necessarily. So we tend to have a group sample that's a little bit older. So things are not exactly the same. So when we do analysis with this, it lets us put that and kind of even the ground and see how things are different. And we changed a bit the question of from who does this more in the frequency to who will be more likely to do this or what's more likely to happen. What is the process that leads from one to the other? It's a bit of leading a line instead of just looking at how things are on a static block. So let's look at it as an example. We've got some data from migrant youth who had sex. Migrant adolescent girls who have had sex, the responses were on a yes to no, have you had ever sex? And we've got here in our little chart, we've got our three groups based on their sexual orientation. So if we've got the LGBT plus, the mostly straight and the straight girls. And we can see how the responses are charted on the percentage of youth who said yes to the question. And we've got 5 years of data. So you see here, we've got a little neat graph that looks at how the percentages of yes responses were graphed out. This is going to help us understand how the trend analysis is going to move forward, but we're going to keep this neat little chart in mind. So what can we do when we're trying to do trends? There are three big things that we want to get out of our trend analysis. We want to be able to compare the changes over time within groups. So we want to see how things are changing, if things are more likely or less likely to happen for a group. So in this example, are LGBT plus youth more likely or less likely to have had sex in 2023 than in previous years? Like if this outcome is going up or going down, if it's getting more frequent, less frequent, what are the odds of this outcome compared to other years? We also want to look at disparities. We want to compare between groups. If one group is more likely or less likely to have an outcome, which outcome is more likely to happen? Or rather, how is this outcome for these different groups? So for example, are straight youth more likely to have sex than LGBT plus youth? So we're comparing within a specific group and a specific year. And then we can identify if these changes are changing over time, if these disparities, if these gaps are increasing or decreasing, or are they staying the same? So we want to look at these three things. So let's break these down with some examples. Let's look at how this appears, all of these three goals with our trends. So when looking at things within groups, when we're comparing in the same group, we are looking at one specific year and how that compares to all other years. So we choose a reference. It could be the first year, it could be the last year, usually. You can choose any year, but for a more clear picture, we tend to use either the first or the last so that we have that yardstick of things going up or down or staying the same. And we use what's called an odds ratio, which is a number that tells us if the outcome is becoming more likely when it's bigger than 1, or less likely, which is a fractional number, so 0.5, 0.7, compared to the reference. If the number is exactly 1, it means that the outcome is exactly the same compared to the reference. So if the number is bigger, a 2, it means that it's 2 times as likely. But if it's a 0.5, it means that it's half as likely. So we're looking at that ratio of the odds. So one question, as an example, is, are the odds of migrant boys to have sex going down over time? So we have an example. We have that little graph. Again, this is presented from our percentages of those who said yes, but this is for our illustration. This is how we're looking at that trend. So we've got two groups, migrant boys and non-migrant boys. And we've got our 3 years, and we looked at the percentages, which was our comparison earlier. Why not percentages? Why odds? And we see here, we're looking at 2014 at our reference. So the starting year at the left, that's going to be our yardstick. Are things going up or going down? And we have 2018 and 2022, and we compare the years. And we see that one of the years for migrant boys, which are in the blue, is significant in 2018, but not 2022. And for non-migrant boys, which are in the red line, the significant difference is on 2022, but not 2018. So I highlighted in our graph what that looks like. We're comparing 2014 as the yardstick, and for migrant boys, 2014 to 2018 showed a significant decrease over time. So almost half as likely compared to 2014. But then 2022 wasn't significant as a difference. So 2022 is not as significantly decreased in compared to 2014, but 2018 was. And for non-migrant boys, we see the opposite. 2018 was not significant. It wasn't big enough a dip, but 2022 was. And the reason I put here a yellow line is to show that difference is between 2014 and 2022. We're not comparing every year as it passes by because it is going down, but we're comparing it to our reference 2014. So that dip is big enough to show that it's going down overall. Now let's look at how we compare between groups. When we compare groups, we choose a reference, just like how we were choosing our year of reference. When we're comparing between groups, we choose our reference group. So when we have multiple groups, like earlier we had 4 groups, 3 groups, we're comparing these groups to the reference group. And with our odds ratio, we have the same thing, bigger than 1, more likely, less than 1, less likely. And this is going to tell us if the group is more likely or less likely to have whatever outcome we're looking at, if it's more likely or less likely compared to the reference. So for example, we could ask, are boys who are in homestay, so migrating and staying with a family that is not their own, are they more likely to have sex than Canadian-born boys? So let's look at the numbers. An example of these gaps. And here I'm presenting with the frequencies as an illustration of what we're comparing for the gaps. So you can see the vertical arrows that are pointing to each other. Our referent is the Canadian-born boys in this case, and it's the green line. And we're comparing them to the migrant youth, the migrant boys who are not homestay, and the homestay boys. So the blue line and the red line are compared to the green, but not to each other, not comparing the blue and the red. This is so that we get the sense of how things are going for different groups. And when we compare, we see 2003, 2008, 2013, and 2018. For the homestay boys in the blue line, the numbers show us that they were about the same. They were not significantly different, except for 2018, where they were significantly less likely to say yes to they had sex ever. But the migrant non-homestay boys, they said they were having less sex than the Canadian-born boys for all the years. Now, when we look at the percentages, you might have noticed that I was saying that homestay were showing less likely to be having sex, but in the percentages, we're seeing the homestay with the frequencies, they're really far above in how likely they were to say yes, or how frequently they were saying yes to this question. So this is an example of the percentages and the regressions for our trend analysis being different. So what's happening here? Why are we seeing this different story, completely different story? And it's because the age. If you remember earlier, we're talking about how we can include other factors to control because our groups are not going to be the same. And one of the major factors that we look at is age. And I included in this table at the top the average age of each group for every year. And you can see that the homestay boys were around 16, almost 17 years old, whereas the migrant non-homestay were around 15 years old for all the 4 years, and the Canadian-born were were about 14 and a half to almost 15 years old. So that big age difference and a significant age factor in the model is telling us that age is a big factor. And because homestay boys were older by a lot, that was making it look like the frequency of having sex was a lot more. And when we're comparing the groups and we're looking at our regressions, we're telling a completely different story. They were having more sex, but it's because they're older. And the older you get, the more likely you are to establish an intercourse because we're talking about adolescence. So one big reason of why we're looking at these trends and these gaps is because there is a difference in the groups. And we want to be able to put in an even playing field. How are things looking? Is there a difference? In this case, we're not talking about something that they're missing or not, or a negative health outcome. We're just talking about adolescents having sex. But we're still seeing that big difference in behaviors in our outcome based on a reference when we put the playing field equal among everyone. We also have our third goal, which is how to measure if these changes are changing over time. Are these differences between the groups having an effect? Maybe there is a change in policy, or maybe there's an intervention that we're looking over time, and we try to make things more equal for everyone. So how does this data, all these numbers, all this information, how does it tell us if things are getting better? So we plug in, just like how we plugged in age, we included a model that includes the year and the group and an interaction of the year by the group. So this is making what we're referring to as a ratio of ratios to tell us if this gap is getting bigger or if this gap is getting smaller or if it's not changing at all. So I'm going to plug in a little bit of math. Don't get scared. It's a lot of math. You don't have to look at all of it. This is just for illustration purposes. And I know it's a lot of numbers and it's very small. Don't try to read all of them. We're going to look at it in a simpler way. But basically, we're looking at how things look for each of the years, if there's a difference or not. And we look at that interaction, and we're able to tell with this mathematical model if that interaction is telling us that this ratio is getting bigger or smaller. If the odds ratio of the main effect is smaller than 1, so a fractional number, and the odds ratio of the interaction is bigger than 1, we have a decrease in the gap, and vice versa. If it's a main effect smaller than 1, but the interaction is also smaller than 1, we have an increase in the gap, and so on. Again, lots of math. That is a lot of math. So let's look at it with a picture. You remember that little lines, the vertical lines that we were comparing the gaps for the groups? Now we're comparing those gaps to each other. We're making a comparison of the year and the group, and we're comparing them to our reference. So for this particular one, we're comparing 2018 as a reference, and we were using Canadian born as a reference. So how does that gap, so on the top right arrow, how does that compare to the top left arrow? And how does the bottom right arrow compare to the bottom left arrow? And we can do that for 2018 compared to 2003, 2018 compared to 2008, and 2018 to 2013. And if those results are significant, it's telling us that the gap is getting bigger or the gap is getting smaller. For with this illustration, and again, we're using percentages, but that's more or less what we're looking at. If that arrow is shrinking, if the groups are getting closer together and the odds of the groups having our outcome, so in this case, we're talking about youth having sex, if these odds are getting more equal. So our interaction is going to compare how the gaps compare to the reference group and the year. And the red arrow is telling us that that is the comparison. We're looking at the big gap in 2003 compared to the small gap in 2018. So when we put it in a picture like that, yeah, the gap's getting smaller. And that's what we look at with the math that we do, is that shrink of the gap significant if that difference is making a difference. So to summarize, we have our trend analysis, and trend analysis allows to go beyond frequencies, beyond the percentages of comparisons, because it is very common to see that that shows us a picture and it says, yeah, so we looked at 20% of youth like ice cream, but then 15% don't like it. And what happened? And we can look at things that are a factor, such as it's summer when we ask one group and it's winter when we ask the other. So the percentages may not tell the same story. Usually we don't have a very obvious factor like that. We can't really tell adolescents to come out earlier so that we have a group that is all average 15 years old. We can't ask them to be the same age. So what we do is with our regressions, we do our best to control for those factors, and we even the playing field to be able to look at how things are going over time. And with this trend analysis, we're able to compare groups over time without having to follow the same people, because it'd be really difficult to do a 20-year-old trend of our outcomes following high schoolers, because it's a little difficult to find high schoolers that have been in the same high school for 20 years. And we are able to see these differences in how likely are things to happen, how likely is our outcome to happen. We can compare these differences and we can check if these are significant differences. Are things, in short, getting better?
Thank you. Thank you, Mauricio. I know that for me, when you said that these, don't be afraid of these numbers, I feel very afraid of large data sets and numbers, but you explained it so well. I think that was important for me to hear, especially. But are there any questions anybody wants to ask? Please feel free to unmute yourself or drop the question in the chat and I'll read it out loud. Or any comments you have.
Thank you for taking the time to have this presentation. My name is Amy Gower. I'm from the University of Minnesota, and we're working on some trend analyses with the new Minnesota Student Survey data, which I know you all have done some work with as well. And I just have a question for you. When I started this before your presentation, I'd started with the Yokohama paper, and there was talk in there about the test of linear trend. And we have some cases where we are seeing a linear trend and some cases where we're not. And I was curious if you're still doing that. And if it's not significant, what implications that is for the trend analysis.
So for our data sets, we're not doing the test of linear trend. we have a very robust data set. So for that specific case, we tend to not have those kinds of concerns. We do have data checks, but for the most part, the beauty of the BCHS that we tend to work with is that it's a big and robust data set that lets us follow for a lot of the time. We go with logistic regressions instead of linear regressions, and so generally that is not a case that we kind of look at. Sorry, Elizabeth, you had a.
I was just going to add because Mauricio, you may not know since our work with the Minnesota Student Survey is, I think, before your time. Amy is actually one of the researchers from the Project Respect from way back when Yokohama was one of our postdocs, and Ryan Watson. Great to see you again, or well, at least hear you, because I know your camera's not working well. So just an addition that the Minnesota Student Survey data, is it still census data as opposed to like cluster stratified samples?
Yes, and
Okay.
it is still census data in that it is offered to every school district in the state at the relevant grades. However, thanks to our political climate, we are seeing decreases in participation, which used to be up over 80%. And in 2022, we were at 70%, and there are some concerns that will be even lower from this spring. So, yes, and I guess.
Yeah, okay. So while you probably don't need to be adjusting like for complex samples the way we do because we're a cluster stratified sample, unless if you're still sampling in classrooms, I suppose that might be part of it. But I think, given the sample size that you have in these age ranges, you probably don't need to worry about a linear test for trend. What you might want to do, as we've done in the past, just to like be really confident about the differences in relationships, is also flip your uh, reference group, or say, okay, well, we'll start with the earliest reference, and then we'll move to rerun it with the last reference, and then we'll run it with a middle group or the middle year as a reference, just so that you can actually look at the differences between each of those groups, or like in that sort of odds ratio, to be able to identify those. But the challenge with the reality for most of our data is that testing for linear trends is unlikely, as things do go up and down, and that's due to the variety of things going on in the world. So our recommendation has been, from the original development when we did this with Bruno Zumbo here at UBC, is if you're looking for trying to get some further being able to talk about the differences, not just from the one particular reference group, is change it up and use a different year as your reference.
Thank you. We have a few more minutes. Are there any other questions or comments? Okay, amazing. I think Mauricio explained everything very well. I've dropped the newsletter sign up sheet in the chat. Please feel free to share it with anyone in your network, and you'll hear from us soon about our next Lunch with webinar series, Lunch with Cerevic webinar series, which happens every third Thursday of the month. Thank you, everyone.
Thank
Thank
you.
you. Thank you,
Thank you.
Mauricio.
Bye.
Thank you.
Thanks, Mauricio. Bye, everyone.
Bye.